started. Just going to give, Kevin just had an opportunity again, so you folks know, Kevin is here, and Kevin turned on our regular recorder, so we're documenting it that way. So if you can just give me a moment, I'm going to go in and try to hit the internal record as well. We're recording internally as well. I just want to read a statement before we get started. In response to COVID-19 pandemic, the Plattsburgh Town Board is using adaptive practices in the best interest of public health. The Association of Towns has provided guidance along with our attorney, and we continue to use Zoom, a remote meeting software, to conduct our meetings. The Town of Plattsburgh Board did log on to the software at 5:30. Just to make sure that the application was ready to go. Thank you for a member of the public joining us this evening, and we'll begin our official meeting at 6 p.m. So can I have a roll call from the clerk, please?
Michael Cashman.
Present.
Thomas Wood.
I'm in the living room somewhere.
Meg LaFave.
Here.
Barbara Hebert.
Here.
Charles Kostick.
Here.
James Coffey.
Here.
And myself.
Resolution 65, approve the minutes of the previous meeting.
Resolved that the minutes of February 28th, March 5th, and March 12th, 2020 be approved, and the reading of the minutes be dispensed with.
Is there a motion to the effect? Kostick, is there a second?
Second.
LaFave, any discussion? Hearing none. All those in favor, please say aye. Aye. Hearing all carried. Going to public comment. Is there anything for public comment this evening?
No, Michael.
Thank you. Next resolution, number 66, abstract 4A-20.
Resolved that the abstract of audited claims number 4A-20, 464 through 521 for $115,831.96. Abstract 4A-20A, 66 through 82, prepays for the amount of $727,762.04 be received as reviewed by the audit committee, and the supervisor is hereby authorized to pay said abstract.
Is there a motion?
So moved.
Wood, Hebert, I want to add just one comment. I want to thank both Barb and Chuck for, again, coming in, making sure that the manual audit was done, and also using the best practices of social distancing to have done that in a safe way, but still making sure that this critical piece of our day in and day out function is achieved. So thank you for that. Okay.
Absolutely. Say the same thing. Thank you, Chuck and Barb.
No problem.
Anything further on this item? Seeing none, all those in favor please say aye.
Aye.
Hearing, so carries. Before I move for the possible adjournment tonight, I thought I would take a moment just to provide you some of the updates that we're receiving from the state. I know some of you have full-time jobs and may not be able to stay on top of every single facet of what's going on, and also to our public. A handful of bullets here. The New York State Department of Health has approved a protocol allowing a BiPAP machine to be converted into ventilators. The state is taking one more approach into being proactive in case we ever get to the apex and there's not enough ventilators. New York State is conducting a hospital-by-hospital survey on a nightly basis to take inventory of supplies. All hospitals are asked to contribute supplies that they don't currently need to a centralized stockpile that is getting to the appropriate regions. Over 85,000 healthcare professionals have signed up to volunteer as part of the state surge healthcare force, including 21,000 from out of state. I think the governor said it really well, and I would echo his comments there. I think it's remarkable when you have a nation such as ours that we're blessed by, that people are willing to step forward and help out your fellow citizens. I think that's just
a huge number too.
it is. It's It's very touching. Consumers and small businesses experiencing financial hardship may defer paying health insurance premiums through June 1st, 2020. For more information, I would always encourage people to go either to the Empire State Development's website or the governor's website. I'm just giving you the bullets. I don't have all the mechanics behind these, but I do want to bring some of these things to your attention. The governor has directed that the state non-essential workforce to continue to work from home for an additional 2 weeks through April 15th. In similar fashion, that also means that our local government is at 50% workforce reduction. We continue to work in a team structure to make sure that we protect essential services. We're answering the phones, and we continue to be there for the public. Statewide school closures are extended by 2 weeks to April 15th. I know that there is a date that has been floated out there in the region because of shortly after the county had their executive order, it was pushed out a little bit further. They continue to be in conversation with the state, and the state is taking basically a 2 week by 2 week approach to some of these things, so it's not pushed out so far that it can't be managed. The one thing that I would really like to drive home, and this comes from my own background in counseling, New Yorkers can call the COVID-19 emotional support hotline, that phone number, and I'm going to try something. I'm trying to still learn the system here, so let me see if I can share a screen with you. Can you all see the support number?
Yes, yes, we can.
Okay, so this is a phone number that's staffed 8 a.m. to 10 p.m. 7 days a week. As we all know, mental health is a huge thing in the daily lives of so many people, but in rural communities, many of the providers do not have the same resources to be able to provide. So please, share this widely with friends and family. It has been shared with our employees, but again, one of the blessings that we have is that we do have that contract with EAS Services, and they've done some remote activities, and that's also been shared with our employees. So this is a resource, but I did want to share it with you and the public. So let me see if I can stop sharing this now. Did it stop sharing?
Yeah.
Okay.
Yeah.
There's a company that's creating over 500,000 test kits for the state at no charge amid the nationwide shortage of test kits and swabs. To date, the state has tested over 230,000 individuals, with nearly 15,000 new people tested on March 31st. So again, we continue to see those numbers increase on a daily basis. A new central coordinating team is helping to implement the public-private hospital plan to share information, supplies, staff, patients among those hospitals across the state. And interestingly enough, a new online portal will connect hospitals to volunteer healthcare workers and help prioritize deployment to hospitals within the greatest need. The reason I bring all of this to your attention is much of the focus continues to be on New York City, because that's where the highest density, the majority of the cases are occurring, but they really are stitching together a network to help all communities throughout the state, including the rural communities. I would also share that a friend of mine, Jacob Avery, was the individual that was in the newspaper yesterday. He's in his 30s. Many people often think of this as impacting only seniors or elderly of our community. It impacts everyone. And I think he said it best that when he shared with me, I've had the flu before, and this just really walloped me. So please be careful, please be attentive. Continue to do wellness checks with your friends and family. A simple text, a phone call, an email, a Facebook, something. People can feel very, very isolated during these times. It's also a great opportunity, even though we're forced to slow our lives down and to evaluate our priorities and to reconnect as a community in some different ways. I'll get off my soapbox, but I did want to share some of those pieces of information. The last thing that I will share before I ask for an adjournment is, yesterday, the city of Plattsburgh did announce a curfew. We have not activated a curfew. I've made that pretty clear in the press and some other things. I'm not here to quarterback on what the city does. That's not my position. The reason I bring it up is there was a lot of confusion as to, is it town, is it city, is it the greater Plattsburgh region? And speaking with Mark Henry, who's the chair of the county ledge, they also received a number of phone calls wondering, well, is the county on a curfew? It's not. Those decisions, if they are made, and I put a huge if with asterisk on it, would be done in consultation with the appropriate agencies. The one for us would be the Clinton County Health Department. And speaking with the Clinton County Health Department, I know that they did not advise the city to do that directly, but they had those conversations as it was appropriate. But in the conversations that we've had, that I've had with John Canoza and others, he does not believe that that is necessary at this time. So just providing some clarity to that. Any questions?
Michael, thanks for intervening as quickly as you did. I was on social media last night when you were kind of following back some responses to people, so your quick action to that immediate message on the town of Plattsburgh website,
Yeah.
thank you, I shared it.
No, I appreciate that. I mean, and again, I apologize, I'm seeing something in the peripheral. Tomorrow at 11 a.m., the Clinton County Health Department will be holding a live Facebook stream press conference media avail. They have been recording those and trying to put them on YouTube as well. I don't think that they have as many resources with Zoom and things, so I don't think that's something that they're offering. But I believe that if you Google Clinton County Health Department Facebook, you can find a link and still watch it and not have signed into Facebook for those that are interested. But I don't know that for certain. All right? Seeing nothing further,
Well, I'd like to say, this is really, it's too bad it doesn't go on longer. This is the highlight of my week, just getting a chance to see everybody. Although I don't get to see Meg, but, someday.
so,
We get to see her block.
yeah.
Right.
She's there. Block's a block, now I'm gonna take a picture.
I cut my own hair and I don't want you all to see it.
Oh.
All right.
Oh.
With nothing further, can I get a motion to adjourn?
So move.
Costick, is there a second?
Seconded.
LaFave, all those in favor, please say aye.
Aye.
Aye. We will adjourn at 6:12 p.m. I'm shutting off the
Everybody
recording.
stay positive and have a good time,
All right, be safe, everyone. Take care.
Good night.
Bye-bye.
Right.
We can go so far into the weeds on that so quickly.
I know. Let me just take this and shut it off here, and we'll be done. Boink.